Greetings, YouTube. I haven't discussed this here on the channel much because I've been dealing with this pretty much on my own, uh, with my wife's help, of course. But I have been dealing with an injury on my right foot for about 6 months. And it started out as a small wound. And as wounds are wont to be on people that are diabetic and have neuropathy, it began to grow. And it got to the size of about probably a U.S. quarter, maybe a little bit bigger, but a good that deep in my foot. Deep enough that the infection I had got into my bones, literally infected my bones. Thankfully, it only infected 2 bones, but once it gets in the bones, there's no helping that with antibiotics. You simply can't get antibiotics to go into the bones, the blood circulation in a neuropathic foot, and the blood circulation into a bone is too poor to allow the antibiotics to do their job. So there was absolutely no way that infection was ever going to go away, and it would just continue to propagate. So on September 17th, I had to undergo surgery. So they came in there, and even though the wound was here on my right foot, so it's here on the heel, not the heel, the ball of the foot right there, right about there, actually. They put the slit in just below my toes, and they went all the way down to here to open it up further. And one of the reasons, besides getting the bones out, is that when they were done, the goal was to then get the whole wound to close up and stitch it closed. I have not seen the wound since I have had the surgery. My foot's been wrapped, and I'm not unwrapping it until I see my doctor on Tuesday the 22nd. For the first couple of days, the only thing I had to walk around the house with was a walker, but I could only walk on one foot. So essentially, I was hopping with a walker. And for a 61-year-old fat man who isn't in particularly great shape, that wasn't a lot of fun. But we got one of these things right here. This is a little kneeling scooter. And this thing has made my life much easier. It's not perfect. It still takes some care on my part. I was never dexterous prior to me getting neuropathy, and the neuropathy made my feet go numb. And I get no haptic feedback from the ground with my feet, which people who don't have neuropathy get without even thinking. So I became even less dexterous, and now I'm essentially pushing myself around with one foot while I kneel on a scooter. So yeah, it is not particularly fun moving around. But so far I've only fallen once, which is good. I have only impacted the wound one time since I have been home, which is good. I've been very good about making sure it's not touching anything. And I don't think I did any serious damage because there was no bleeding. It was not a particularly fun process for me. I don't like needles. They put the needle in here because I had blood drawn not long ago. This is like a week old. The phlebotomist that worked on me is really not talented. Okay, so they didn't want to put it in there, so they put the IV in there. Give me fluids, give me antibiotics directly into my veins, and then they put me out. But they didn't want to go real deep because deep anesthesia runs a lot of health risks. Sometimes people under deep anesthesia don't come out of deep anesthesia, so they put me under fairly lightly. I would go the deepest, and then I would kind of come up to a surface level, and then I would just kind of be floating just below consciousness. That was the goal. And they did it that way because the doctor would have to put direct shots into my foot to numb it, and that would be the most painful part of the process, they said. So they wanted me not experience that at least, which was awesome. Unfortunately, when they put me in that kind of little light level of anesthesia, they didn't take into account that my doctor, when it comes to suturing, is aggressive. And I could feel those sutures go in. Not the needles themselves, but I could feel him going as he's pulling the wound closed, which was not pleasant. But it's over. I'm sitting at the desk right now, and I'm not going to be here for long. I'm going to be here long enough to get these videos I need to film for this week done, and I will load them up tomorrow. Because I want to limit the amount of time that my foot is not elevated. I want to keep my foot elevated as much as possible. But I film in here, and I can use my laptop in the living room, and I can just respond to stuff there, which is much easier. But I put all my videos onto my external hard drive, and taking that hard drive into the living room and hooking it to my laptop would be a pain in the butt. So I'm just going to film here. I'll upload them tomorrow, and my goal is to spend a couple of hours in here every day, but spend the rest of my time on my butt with my foot elevated because I have a lazy boy recliner. I turned 60, and I figured that legally I'm required to get one. So I'm going to be out of work probably until November 18th. That's what we're thinking about. I need to make sure that my foot is 100% because I work in manufacturing. I am a lead operator, and my job is very dynamic, and I stand on my feet all day long on concrete and wearing steel-toed shoes every day. And the only time I'm not standing is when I'm on break. And then my job requires me to push and pull. I move wagons that weigh 450 pounds. I pull pallets. I climb ladders. I lift things. I carry things. I don't carry them as far as I used to because I have Charcot foot on my left side. But I still have to lift them and put them on shelves and pallets and where do they have to go, that kind of thing. And though technically the lift limit at my company is 35 pounds, let's just say that it's not the most stringent criteria that we follow. Just the other day, I had to get help with a container of waste material that I had to go weigh before it was disposed of. And the waste material container weighed 84 pounds. Even with a two-person carry, which I got because I'm not stupid, it was still a violation of our lift guidelines. But there was no way to get three people in there. So two of us kind of pushed ourselves and got it over to get 42 pounds a piece. Which isn't bad for two people, and I mean, I didn't mind doing it, but it's still a violation of our safety codes, so I complained. I said, this weighs too much. Whoever put this much waste in this thing should really have maybe done it in twice, did it in 2 trips, or maybe even 3, just so that we didn't have to violate our lift goals. So that's the kind of environment I work in, so I want to really make sure that this foot is healed 100% before I go back and do that. So I have a new custom-made orthotic insole in my boot, so this shouldn't happen again. I did not have that at the time. In fact, the reason I got this wound is I had tried to wear a boot that was matching the one I wear on my left, because the one on my left has to be large enough to fit over my brace that I wear on my left foot, and that was a mistake. By wearing that, I gave myself an abrasion over the top of my foot, which healed very quickly, but it's not because it's not under pressure. But it gave me a small wound on the bottom of my foot. And when you're diabetic and you have neuropathy, it's not hard for a small wound to become a big wound. And I have decided not to put the picture of the wound in this video because I did take one. I wanted to have a comparison between the before and the after. Because it's not something most people want to see. And I encourage people not to look up the phrase ulcerous wound. You will regret the decision if you do that. So thank you for listening to me rattle on about my current health situation. I appreciate that. I'm going to recover from this. I will be back at work as soon as I can. I am on short-term disability. It means I get a 60% pay amount. For the first 7 days, there's a gap between when the operation started and when the short-term disability kicks in. So I'm using PTO for those 7 days, but after that, I'm going to 60% of my pay. We have money stocked aside. We could actually cover all of our household expenses for 4 months if neither of us was working. So at 60%, we're not going to be in any kind of trouble. It just means that we're going to have to be a bit of an austerity plan. So yeah, it stinks. And sitting on my butt isn't all that exciting, but it means that I'm going to be able to heal, which I'm happy about. So I hope that none of you have ever had to deal with an ulcerous wound or any kind of surgery on your foot, because it stinks getting around your house, even with a helpful little scooter. I mean, I have to turning in this office on that thing is not simple. It's much easier. When I'm sitting, I can pick it up, turn it around, and point it at the door so I can get out of here. And the brakes do lock, so I can lock it in place so it's relatively stable while I actually get myself onto it. And once I get myself onto it, it is relatively comfortable. Once you get your knee over the center of the gravity, it's pretty comfy. It really is. I will eventually do a review on this thing after my healing is completed. So yeah. So thanks for listening, and I hope that you folks are hale and hearty and never have to deal with this kind of bull yourself.